Hello, this is Chelsea Dade, founder of Communicate for Health Justice LLC, and welcome to CFHJ's Soft Launching Justice podcast. Soft Launching Justice is a podcast exploring how young people of promise are shaping the future today by demanding more. Hosted by yours truly, each episode unpacks the systems youth are influencing and challenging today, from digital culture and public policy to workforce and leadership pathways. Through real conversations, this podcast holds space for emerging advocates who are leading boldly while challenging norms, even if we're all still figuring it out together. Subscribe to the podcast on YouTube at CFHJ. Well, hello everyone, and welcome back to Soft Launching Justice. We are discussing mental health this month. July is Minority Mental Health Month. So some say that while millennials were the first to start peeling back the conversation about mental health, Generation Z completely broke the mold open. From rejecting the toxic hustle culture made popular by previous generations to destigmatizing therapy, there have been several shifts in mental health made better by this generation. On this month's episode, we have youth mental health advocate Beatriz Cazo Garcia. Welcome, Beatriz.
Hi, Chelsea. Thanks so much for having me on the podcast.
Well, thank you very much for being here. I am very excited for this month's episode. And like always, we'll go ahead and dive in.
Sounds good.
So, first question, what's one misconception about Gen Z mental health that the media runs with?
One misconception about Gen Z mental health, and I see this all the time when I'm scrolling through my feed on social media and Instagram, is that Gen Z is more anxious or less resilient than previous generations. And honestly, I think what's happening with this misconception is that Gen Z is more willing to talk openly about mental health and really put into words their experience, and perhaps more so than past generations, which is why we're hearing about mental health more, and we're hearing about people's experiences more. So I think there's a lot more representation, and that's why a lot of people kind of believe this.
Thank you. And I have seen that. Pop up. There's there's also like a book about it as well. So I think it's really helpful to hear directly from someone in the generation on why that might be. So I appreciate that response. So at Communicate for Health Justice, we think about health justice as creating conditions where all communities and generations can thrive and access well-being. What does health justice mean to you?
Yeah, that's a great question. For me, health justice means, I guess, that your well-being and your access to healthcare isn't just determined by things like your environment, your race, or the circumstances you were born into. To me, it means creating a world where everyone has a fair chance not just to survive, but to thrive too. Especially with mental health, I often see a lot of barriers in place for people from underserved backgrounds, and I think that that's definitely something that needs to change if we want to promote health justice more.
Definitely. Yeah, representation will always be an important part of, I would say, equity work. There's a lot of layers to it as well, but it will always be something that's really important.
Definitely, yeah.
Okay, so for our third question, it's actually kind of similar to what we were just talking about, but no one person is a monolith. We say this a lot, that we each hold multiple identities that impact our personalities. According to Mental Health America, racism is widely recognized to negatively impact mental health and well-being. Those who experience acts of racism may show signs of racial trauma, though not everyone who experiences racism will also experience a mental health condition. Well-being can be affected by racism in many ways. So, with all of this in perspective, it actually makes a lot of sense for people with various racial and ethnic identities to not be as vocal about their mental health for fear of, repercussions, things like that. So, from your perspective, what are some ways youth can support authentic representation of mental health narratives that address people's unique experiences?
Yeah, that's also a really good question. I think the first step is honestly just making room for complexity. So I feel like often mental health conversations are treated as like universal experiences when actually, kind of as you just mentioned, things like race, but even taking into account immigration status, language, socioeconomic background, things like that, those factors can all shape how people experience mental health and seeking support, especially I've seen it firsthand just from people in my community, and it can make it really difficult. And I think that one way that youth can support authentic representation is by kind of putting a spotlight on stories from people whose experiences are overlooked. And I guess kind of like as I was alluding to earlier, representation is a really big part of that. So honestly, like things like this podcast are kind of something that's working towards that solution. And having spaces like this where young people can get more involved with leadership, advocacy, storytelling, sharing their experiences, so that mental health narratives can be are being shaped by people's experiences and people of all different backgrounds, so that we're not just hearing one message.
Definitely. And I appreciate that. I do hope that this podcast can be a space for Gen Z voices, and it's definitely needed. Let's see. So for our next question, research from a 2021 report by the American Psychological Association says that Gen Z adults at 46 were the most likely generation to say that their mental health has worsened compared with before the pandemic, followed by Gen Xers at 33%, millennials at 31%, boomers at 28%, and older adults at 9%. They offer helpful suggestions that youth can do individually to improve their mental health themselves, like getting more sleep. What structural changes would you recommend to improve youth mental health?
Yeah, great question. And yeah, I think things like sleep, as you mentioned, can definitely help. But I also think that aside from, smaller changes that we can make in our day to day, it's also really important to think about things, looking at the bigger picture. And I think that one structural change would definitely be expanding access to mental health care, especially in schools and underserved communities. As I've seen in my community, there's sometimes not always systems or programs put in place to help youth with that. At least at my school, I go to Smith College, and they're really, really great about providing support for first generation students, specifically for like mental health. And honestly, I just finished this past semester a research project, which was really focused on that. It was more so focused on first generation experiences in college environments and finding belonging and finding a sense of mattering in the classroom, uh, as well as in extracurriculars on campus, in experience within like experiences with peers. And I think it's projects like that that really that focus and like take into account like a specific audience and just kind of working towards a change in the community. So kind of like what my motivation was for that project was making sure that people felt seen. So I would sit in focus groups, kind of hearing people's experiences, specifically even like their high school experiences and how that shaped the way that they approach college environments now and asking for help and seeking support, and just approaching their mental health in general. So I think projects like that really focus in on trying to support like a group of students who aren't always represented in mental health is definitely super important. And I think that another thing is really just building stronger community connections. I know a lot of young people, sometimes including myself, who feel isolated or just kind of like not very supported with their mental health, despite our generation being more digitally connected than ever. So I think that because of that, we have to invest more in community organizations and mentorship programs, just spaces in general where youth can build meaningful relationships and hopefully find a sense of belonging, which is again kind of what I was trying to do with my research project this past semester.
That's amazing. And that's definitely why I wanted to chat with you, Beatrice, because your passion for this subject matter definitely shines through. And it's so great to hear that you're already doing research on it in school, and then you're passionate about, authentic representation in this space. So yeah, thank you very much for that very thoughtful response.
Yeah, thank you.
So then we have another question. For people working in the youth mental health space, whether that's in nonprofit, healthcare, or somewhere else, what practices do you believe would help move us toward a more equitable mental health system?
Yeah. So one strategy that I definitely tried to implement, like with doing this research project and something that I hope to continue to do as I do more research and hopefully get more involved in mental health, is just remembering who your audience is. So, and making sure that you're really listening to the community you're serving. That's why it was so important to me, going into this project that we had Zoom interviews, in-person interviews, focus groups, actual in-person like experiences, like connecting with another person one to one, or even just in a group about their experiences. Because I find that yes, it can be helpful to do all the reading on mental health and on first generation experiences and kind of how students' upbringings and socioeconomic situations can impact the way that they view their mental health and approach college experiences and things like that. But I also think that the most that you can learn is from really just the field work, from going in and talking to people and hearing from their experiences firsthand, because that's where you really gain the most insight. And yeah, that just overall, that's a really important strategy that I would definitely recommend. And I think another would be just designing programs with young people rather than for young people. So some of my other mental health advocacy work includes being a part of the Pioneer Valley Youth Council, as well as the Pioneer Valley Action Board. And those are groups where, since I joined in 2020, and I'm still in the group, so 6 years later, it's been great. And I just get to connect with other young people who are passionate about mental health. And we do have like leaders in the group who are older adults who have been running the group, since I've been there. But they approach our meetings in a really interesting way where they're facilitating, but they're not trying to take over. They're trying to create space for youth, asking questions, just making sure that we're talking about things and taking on projects that we're passionate about and that the whole group agrees that are important, instead of just trying to dictate kind of what we do. And I think that that's really important if we're going to do some kind of program or project or initiative that's tailored towards young people, to really make sure that we're keeping them at the center of it, because that's really important. As I said, it's important to hear people's experiences, because that is where you learn the most. I think another really important strategy is recruiting also more diverse mental health workforce, and just getting rid of those barriers in place for people, like financial barriers or just other barriers that are in the way of them receiving access to mental health care. And I guess the last thing would be just broadening our definition of expertise in the mental health field. Clinical knowledge is really important, but as I said, so is lived experience. And I feel like, again, the most effective systems are the ones that bring together all groups of people from all walks of life, especially when it's centered around conversations like mental health. I think it's important to get as many perspectives as possible.
Yes, I love that response. So many nuggets of wisdom from addressing kind of like, unfortunately, there's a lot of like tokenism with programs that are created for youth and not by youth. So, the principle of nothing about us without us doesn't always, well, I think more so it's starting to funnel into youth focused work, but it doesn't always look that way. And I often see it, and I have to also, as a youth advocate myself, I have to think about ways to, push back off of that too. So I really appreciate you sharing. And yeah, I love your passion for the subject matter, and also again really highlighting the importance of lived experience in addition to like the the clinical side of this topic is so important. So I certainly gleaned a lot from this conversation. I'm sure everyone else will too.
Yeah, thank you so much.
Well, thank you very much for being on the podcast, Beatrice. And thank you to our listeners. Make sure you continue to follow CFHJ on YouTube for more updates. Take care, everybody. Thank you for listening to CFHJ's Soft Launching Justice podcast. We hope today's conversation gave you something to think about and something to act on. When it comes to the topic of mental health, remember to follow your individual path. To really protect your mental health, one thing you must do is take the steps to find a self-care practice that works for you. Maybe it's journaling, attending a weekly yoga class, cooking or biking, whatever suits your fancy. If this episode resonated with you, take a moment to share it, leave a review, or send it to someone who believes in youth voice and health justice. That's how this community grows. If you would like to be a guest on the podcast, you can learn more about joining us at cfhj.org and on social media at cfhj. Until next time, keep asking questions, keep pushing for justice, and keep communicating